Hi friends, welcome back to Coffee with Ravi. This is our first post for 2021 and I'm hopeful for 2021 for many reasons, including the vaccine. My post today is about how vaccines work and an overview of where the vaccine development is. There's approximately 190 vaccines in development and 14 in phase 1. Phase 2 is 13, phase 3 is 12, and there are two vaccines that are actually out in the market, which is the Moderna one and Pfizer. The vaccines go through phase 1, phase 2, phase 3 testing. The interesting thing about it is that this has been done at unprecedented speed, and I have a table in there about how long the previous vaccines took that are in deployment, such as polio, chickenpox, mumps, etc. And COVID vaccine was produced in 11 months. So kudos to the scientists and the scientific community for bringing it to us. To understand how vaccines work, you have to understand the life cycle of the virus. What happens is that the virus, after it enters the body, latches on to the human cells through the so-called spike protein, which fits into these receptors in the body. On the surface of the virus itself, there's another protein called M protein. And the reason I'm bringing both of these to your attention is that the spike protein and the M protein are both potential targets for the vaccine production. The virus enters the cell, it then hijacks our own cell's machinery to produce more virus, and that's how it replicates. The first big category of viruses are what are called viruses using nucleic acid, which is the DNA and RNA. DNA is the genetic code, RNA is the code in the cells that helps cells make protein. The DNA vaccines enter the cell, they get into our DNA and then make proteins that then trigger the immune response. And here's how the vaccine works. The vaccine triggers the body to make these spike proteins, which are on the surface of the cell, so the body's own immune mechanism then gets primed to respond to the actual virus should it try to enter our body. It does it through two pathways called B cell line of defense. That's what makes antibodies to the virus, and the other is called T cell, which defends our body in a different way. So our body has two ranges of weapons that it deploys against viruses. One is the B cell and the other one is the T cell, and these vaccines actually activate them and have them in a ready state so that should we have virus attacking us, these defenses are deployed. And I have a list of the DNA and RNA virus vaccines, which include the Pfizer, Moderna, and I have a list of the other ones that are still in development. The next subgroup is viral vectored vaccines. What this means is that the body is exposed through the vaccine technology to either a virus that has the genetic material of the COVID virus encapsulated in a different virus. So you can actually think about it that we are delivering a harmless gene to the body in this mechanism to again trigger the immune response. Example of this is the AstraZeneca one that we've been reading about through the University of Oxford, that is being deployed in England. The next group of vaccines are what are called subunit vaccines. The subunit vaccines deliver viral proteins to the cells. So for example, an empty viral shell can be delivered so that it's exposed to the body's immune system. And as we talked about, the body's immune system is twofold: the B cell, which produces the antibodies, and the T cell, which fights off by a different mechanism. The second part of the subunit is the different aspects of that virus shell that we talked about, either the spike protein or the M protein that can be delivered through this mechanism. Examples of subunit vaccine include the Novavax vaccine that is in now phase 3. We're expecting that. The next group of vaccines are the traditional vaccines, which are weakened or inactivated virus. By old-fashioned approach, the virus is then weakened or inactivated. So in other words, there's a live virus which is inactive or an inactivated virus which is dead that's injected, and that triggers the immune response. There's a lot of these vaccines that are in development. They take longer to manufacture and develop. And examples of this are the Chinese vaccine, which is the Sinopharm. There is a Bharat biotech vaccine, which is going to be deployed in India that uses the same technology. And there's a whole host of others. But my goal today is to give you a sense of the different mechanisms. There's no head-to-head trials. For now, the vaccines that are effective that are the Moderna one and the Pfizer one. And lastly, I was going to do a little post of myself getting the vaccine. I did not experience any side effects, and I do believe that this would be helpful for healthcare workers, for all of us, for patients, to prevent COVID vaccine development.
Good? All right. You got it? How was it? Did you feel that?
No.
It stayed in there an awful long time.
It did stay in there. Thank you for staying with me on a terse topic, but I hope you have a deeper understanding of how vaccines work.